I want to say thank you because for me, it's really a great pleasure to be here and to see, after working 2 years in Sierra Leone, that things happening down there are also moving things here in Europe. So for me, it's really a great pleasure to be here. My name is Noemi. I'm PhD in molecular biology. I've been doing research in malaria in Gabon and also in parasitology in the Netherlands. And in 2016 and 2017, I've been head of the lab in Masanga Hospital. Before moving forward to tell you what's been the evolution of the laboratory during these 2 years, I want to mention Tom Hesnick. He was supposed to be here. He's also in night shifts. Unfortunately, he could not get rid of them, and he was supposed also to present some data from this presentation. So, of course, all the work that is going to be mentioned is a teamwork, and it's being done in collaboration with him and with the management team down there. So, the medical laboratory in Masanga Hospital. This is the team, Esai, Maswell, and John. From the 3 of them, only Maswell is being trained as a lab technician, but the 3 of them are working really hard, long hours, a lot of efforts, and they are really willing to learn and to bring the lab to the next level. When I arrived, these were the diagnoses that we were performing in the lab. These are more or less the common diagnoses in most of the district hospitals in Sierra Leone. And this is the laboratory. It's a really big facility. We are very lucky in Masanga Hospital because we have a lab with a lot of rooms, with a lot of space, with a really great potential. But yeah, it was an old building. You could see that there were a lot of leakages in the roof everywhere, and not only the structure of the lab was old, also the performance and the care we were taking of the lab, it was not the optimal. You can see that there were nests of insects in the blood tubes. They were not being followed standard procedures during the diagnosis. There were sometimes raw collection of samples, patients going everywhere, 2 entrances in the lab, people moving around. So the accuracy and the quality could be improved. That's why we did the project, the rehabilitation of the laboratory hospital. Why? For what I just mentioned, and also because laboratories are crucial. I think they've been also a bit neglected in the past. I think Sierra Leone, with the Ebola crisis, got aware how important the laboratories can be for surveillance, for example, for disease outbreak surveillance. And they are essential for having high quality diagnoses that are going to be helping to give the proper treatment for patients. So how we did it? We did it approaching these 3 branches. We are going to go one by one. In first place, the Heineken African Foundation project. We have to mention Jure van Kinsteren and Bart Valdewein. They were the medical officers in the previous time before I arrived, and they applied for a grant in Heineken African Foundation, and they gave it to us, and it's been a really great support. Without this grant, I think we could have not reached this great improvement of the lab. This project was giving us support, financial support, in different areas. First of all, in the rehabilitation of the building. So everything was changed, from the roof to the doors, new benches. You can see the difference from the before and afterwards, new painting. So it was really, the improvement already in the structure was really great. They also supported the hospital with sponsoring 2 people. One of them, Alfred Conte, from the lab to go for training for 3 years as a lab technician, and another person from the pharmacy. They also supported the blood bank and the cold chains. You are all aware how important it is to keep reagents and medicine in the proper temperatures, and of course the blood for transfusions, for emergency C-sections, for kids with malaria. Thanks to this grant, we could put 24/7 power in the lab. We could give a backup for the fridges. So it made a really difference. And also this 3 years project gave us allocated some money for the purchasing of reagents and equipment, who gave us the opportunity to have machines like this one here, who allow us to do now liver and pancreatic functions, for example. The other two branches, I put them together because they go hand in hand. Is the training of the staff, reviewing of techniques, implementation of new techniques, and implementation of quality management systems. We try to find time as much as possible to do training in the lab with the staff. I train them not only practical, in errors that they were making maybe with mistakes, making mistakes with equipment, with pipettes, and etc., but also training them in the theory behind the techniques, why we were doing one thing and not another one. And at the same time, as I said, we implemented quality management system, and we were based in this international standard, quality standard, the ISO 15189, that describes the requirements for medical labs. And basically, you have to control the processes described in these 12 blocks. Once you say, I ensure these are working fine, you can say, my lab is doing quality diagnostics. So that's what we were putting effort to try to fulfill these requirements. For that, we did a lot of things. I trained the staff in good clinical laboratory practice. We put a lot of effort in writing a standard operating procedures. These are the protocols to perform the techniques, and we really focus in get the staff to get the point how important it is that doesn't matter who is doing that technique in the lab, that the results should be always the same, because we have to follow always the same procedure. Also, they learn how to write them, how to review it, and it was really interesting for them to get to know these things. The lab was subscribed for external quality assurance. That means that we were evaluated by external party in malaria and tuberculosis reading. So that tells us how good and how bad we are. They point at us our weaknesses and make us improve for the future. And together with the hospital, we put a lot of infection prevention control measures in place. During the renovation, we closed doors, we opened doors, all in order to change the workflow in the lab. There was now a restricted area. The lab is only for the staff, no patients. The patients are only in the waiting area and in the sample taking room. And as a result, as I'm saying, we had a lab, brand new lab, that has different areas. Also, the techniques are now in compartments. There are no cross-contamination between samples. And yeah, there is no time to get all the details, but there was a picture missing, but yeah, we are putting effort in the standard procedures. We are doing a lot of good monitoring and good documentation as well in every aspect, not only in the results of the patients, but also in what we are doing in the lab, everything from opening reagents till giving out results. We've been implementing new techniques, and also there is a picture missing. Okay, here there was a really happy picture because the lab got a prize in the best word in infection prevention and control. So all these things brought us to a more professional laboratory that was winning prizes in the hospital and who was working more safe and was working safer and giving better diagnostics, better quality diagnostics. In parallel to these improvements of the structure and of the way of working, I started to collect the data we were generating because we were creating a lot of data, but nothing was happening with it. So data that with a very simple analysis can give us a lot of information, can help us in our daily life and can help us for the future in the hospital. Here, for example, just the influx of patients from January to December in 2016. How many patients does the lab receive? How many are inpatients? How many are outpatients? And with this, for example, it can help us for the ordering of reagents for the next year. Because in settings like this one, we need to order once a year, so we really need to know very good what's going on in our lab, in our hospital, everywhere. For us, also in the lab, it was very important to get to know the number of tests we were performing per month, if there were differences between months or not, when new doctors, new STPs, new students were coming, did we change in our patterns of diagnostics, for example? For the lab was also very, very useful for me to see every month how many positive cases we were getting in every test. For example, I always tell this story. I realized that we were doing an incubation time of one technique for 1 hour or 2 hours instead of 24 hours because we didn't want the patients to go back home and have to come back the next day. So I said, yeah, but we are maybe missing a lot of positive results because we are really shortening the incubation time. Once we started doing it the proper protocol, we started from 5% positive cases to 20% of positive cases in that test. And I could show the lab, I could show the staff. You see, by following the standard procedures, but following the protocols that have been described, we can really pick up more positive cases. So it's been very helpful to have all these pictures as well. In 2016, I was also analyzing the data from the blood bank. The blood bank is here in our hospital as well as in the rest of the hospitals in Sierra Leone, relies in rapid diagnostics tests for the screening of donors. We test them for HIV, hepatitis B, hepatitis C, syphilis, and malaria. So yeah, so we screened the donors, and in 2016, as I was saying, I analyzed what was the situation after 1 whole year of screening of donors. And I realized that from 326 people we screened, we only bled 179. That means we rejected 147. 45% of the donors who came to give blood, they were rejected because they were positive for 1 or 2 more of the test. And looking at the diseases they have, we could see that the prevalences of HIV, hepatitis B, and hepatitis C, and it was, for me, really impressive to see the high prevalence for both male and female of hepatitis B and of hepatitis C. Due to this, that it was for me really concerning, I approached the Minister of Health of Sanitation and asked him whether Sierra Leone was aware of this maybe problem, because after all, this was only the situation in our hospital, but probably also in the rest of the country. He was very receptive to this problem, and he said that indeed is a concern for the country. And we also, together with Dr. Tom, we approached Professor Grobos, and then we wrote a report, a short report, that it turned out to be a correspondent in the Lancet, that the minister himself agreed to co-author, and we were making an urgent call of action to put measures in place, because not even the health workers in Sierra Leone are mandatorily vaccinated against hepatitis B. We are not following the rules or the recommendations of the WHO for avoiding infections of newborns, for example. So I think this is a really great example how improvements and how putting effort in the lab can lead to a direct consequence in the healthcare for the whole population, because I gladly heard that they've been put in the agenda of the ministry, the hepatitis B issue. So just to finish quickly, futures perspective for the lab, now that we brought it from one level to a higher level. We want to establish a lab technician training center in the future. We are discussing with the government the opportunity to become a reference lab, maybe for malaria or for tuberculosis. And something that is actually happening that brought us here together is the establishment of the Masanga Medical Research Unit that you are going to hear next. And what do we need? I think later you are going to hear more what we need, but obviously we need to keep on focusing on capacity building, implementation of new techniques, finding financial support that goes continuously. We should start digitalizing the data not only in the lab but in the whole hospital, and we should put pathology service, culture labs for which need new equipment, more expensive and complicated equipment. So thank you so much, and thank you.